So my name is Professor James Wolffsohn. I'm the Dean of Optometry at Aston University in Birmingham in the UK, and I'm also on the board of the Tear Film and Ocular Surface Society, TFOS. This session was a collaboration between the European Dry Eye Society and TFOS, and was 3 talks on modern therapies and how they fit with the new TFOS DEWS III and the algorithms to help you to get from the definition of dry eye, which is formed based on our evidence-based understanding of the pathophysiology, through then to the diagnosis of the condition, which has stayed largely the same with slight modifications based on the latest evidence, and then through to subclassification. Now, instead of doing just evaporative and aqueous deficient dry eye, actually the majority of dry eye is evaporative. So if we want to manage it better, we need to really break that up into the etiological drivers. And so TFOS DEWS III now looks at 9 etiological drivers that we can derive from our normal clinical tests. And Jennifer Craig was talking about particularly how we can identify from our normal clinical tests those patients that have an inflammatory component. And then how we can take that understanding of those drivers, multiple different drivers in an individual patient, and choose management therapies that fit most with that. So I was talking about amniotic membranes and particularly how they have a role in regeneration and reducing damage to the ocular surface. And then José was talking more about the effects of surgery, not just anterior eye surgery, but also posterior eye surgery, and the importance for ophthalmologists to make sure that they're really looking after the ocular surface during those procedures, not to cause problems for the patients further down the road. So TFOS, looking at the evidence base, really should help clinicians in future to be able to manage their patients better in the future.